Is this working? Great. Thanks to the Hint Summit for inviting me. I really appreciate it. I'm learning a lot. I'm new to healthcare with this company, so events like these really educate me, and obviously there's a lot of pioneers here in this movement, and I'm just really thankful for all the work everyone's done, so thanks. What I want to go over today is what's SteadyMD, and the term virtual direct primary care. We don't use that always, but I think it's a pretty good description of what we do. How does the modern consumer want to participate in healthcare, and how does virtual DPC benefit employers specifically? We are kind of flipped from the previous panel with mostly consumers, and we're just starting to get into employers and learning how to engage that market. For employers, just a few specifics that are directly related. The employees get an aligned direct primary care doctor available via our technology, which we've really focused on building the best-in-class ways a doctor and patient can communicate. A team of centralized medical assistants to kind of steer spending or steer other healthcare needs beyond the primary care doctor throughout the system. And then very high engagement and trust with our doctors, and that's basically our product. We try and build a trusting relationship between the patients and the doctors, and also between the doctors and us, and the patients and our company as well. So what is alignment and how do we do it? If you come to our website, every patient goes through a matching quiz where they specify the criteria they care about in their doctor. So if you want to lose weight, or you have a specific exercise routine, CrossFit is a good example, that's one of our bigger categories, and you're a vegetarian, we'll find you a doctor who actually participates in all those activities. Also, if you have a chronic condition, we can find a doctor who's an expert in that chronic condition. So that extra layer of matching creates an alignment and trust that's difficult to get in the physical world, and that's kind of our special sauce, and why the virtual piece actually enables this deeper relationship between the patient and doctor. And the patients get a choice. We can onboard everyone in this room right now. So if you have a geographically dispersed group of people, there's not necessarily going to be the right DPC doctor for them in their area. So we have a panel of doctors they can choose from, obviously based on, there's a lot of regulatory stuff around state licensing and all that, but in general, you'll have your choice of doctor. If one criteria means more to you than another, you can pick a doctor based on that. I think that actually provides better care, as well as an emotional connection, which means you'll be more engaged with the doctor, and therefore have more engagement, which leads to better care and trust in the system. Limited number of patients. You guys have been pitching this for years. We have the same thing. Flat fee. A doctor has time to listen to you and pay attention to you. So same dynamics. We do not deviate from that. We don't do fee for service or anything of that nature. Really, our doctors have a direct relationship with the patients, and that's the product we're selling. But we do have a very robust technology platform. So every patient starts with a 1-hour video onboarding, where you have your medical history, family history. You get to know the doctor. You engage in a conversation around what you want to work on throughout the year, and then you're connected via phone, video, as well as a very robust chat system. I know a lot of you guys use Spruce, so I think it's similar to Spruce, but we think I think it's the best chat app to connect with a patient. If anyone uses Slack, it's very similar to Slack. So you have the concept of channels for different conditions. Also, we loop in our front desk people within the chat system, so they can handle the other kind of care you need, like prescriptions, labs, things like that. Really, as we've evolved the company, we've realized that we're really a complete healthcare solution for our patients. We control all their spending, or not spending, but their care. We'll book their labs for them. We'll book specialist visits for them, x-rays, prescriptions. We're basically fully enabled to do all this, but we centralize that function in our back office, so the doctor doesn't have to do any of that stuff. My mission is to have the doctor just take care of the patient and not worry about anything else. So we try and take all of that off their plate. Sorry if this is too pitchy. I know Michael didn't want me to pitch, but this is really what we do, and I think it's informative of how the best way to do it. So I don't want to excuse me if it's too much of a pitch, but so we have a great back office team that takes care of anything the doctor needs. They'll facilitate with our group of trained medical assistants, and they'll help the patients pick the right insurance plan. Obviously, schedule with local in-person specialists if you need to be seen in person. We'll find that person for you that's covered under your insurance plan and get you in the door, and then handle the records exchange after that, and then prescriptions, labs, X-rays, the whole deal. More on the tech platform, obviously. If you're just doing virtual, you have to kind of have a full suite of services. That's educating the patient on what you do, doing that matching quiz and onboarding and scheduling them. Obviously, keep the patient happy and engaged with a great technology, chat application, scheduling system, patient engagement tools. And then on the doctor side, you have to have fully enabled EMR, dashboards, phone system, the whole deal. Let me go back one. We get a lot of these questions, so I don't think I need to tell you guys how we're different than Teladoc. That's obviously like urgent care. And then we see ourselves really in your category, direct primary care, concierge medicine, but completely virtual and not constrained by geography. So obviously people want that in-person relationship, but we add that layer of alignment to kind of account for that, and there's going to be room for both, I think, in this market. Just a summary of what we do. The last point is kind of, I think, interesting. Our median age is 40. So that means half of our patients are less than 40, and we normally charge $99 a month to consumers. So that's for consumer healthcare, that's pretty unheard of to have that sort of engagement from a younger, healthier population. So I'm super excited about that because that means we can practice true preventative medicine with a group that hasn't really engaged with that because the system's designed for sick care, and they don't get sick. So we give them a system that allows them to have a doctor for the rest of their life that practices preventative medicine. Coffee, let's do it. That's it. I'm around for any questions, and also one of our doctors is here, Dr. Danny. He's one of our best doctors, so I think he can answer any questions from the doctors if you're interested in chatting with him about the care and the model. Thank you.
Awesome. Thanks, Scott.